Okay, here's the book. It's called Prevent and Reverse Atrial Fibrillation, AFib, and Congestive Heart Failure. This is going to be part one. Pretty thick book. I actually think this is one of my better books. We're going to be starting on page 7. I've done a little intro of it before, and you should get going on this stuff right away if you've got atrial fibrillation. You know, work with your doctor, your nutritionist, or whoever you're working with, your healthcare provider. But what I'm trying to say, why do I make this book? Because there's a tendency for the patients all to either take a pill or to go for an ablation. And what I'm saying is there's good reason to believe that a huge number of these patients could just reverse it totally if they do so quickly and they optimize their diet, their health, avoidance of toxins, avoidance of mitochondrial inhibitors. So atrial fibrillation is a bad disease. 14% of patients are dead in 1 month for one paper, especially like older patients. 25% of patients over 65 years of age are dead in 1 year. 48% of patients over 65 years of age are dead in 5 years. That's like dialysis, half of them dead in 5 years. And it's kind of scary. It's a good way to become demented because if you're not pumping blood adequately from the heart, you'll underperfuse your brain. Hypoperfusion of the brain causes death of brain cells by apoptosis. That's the Jack Delatory hypoperfusion dementia theory, okay? The mouse equivalents. Remember, he tied the carotids off in a mouse 2 months later. Middle-aged and older mice will become demented. And so, like I'm saying, AFib is usually preventable. So there's a lot of known causes. Avoid the causes. Get good blood flow to the heart. Avoid mitochondrial inhibitors. You got a good chance to reverse this. All right, so for question number 1, does AFib cause dementia? Of course it does. It can cause dementia mainly by hyperperfusion of the brain, but it's also a common cause of a big stroke. You get sluggish pumping from the heart. Is sort of wriggling like a bag of worms. You can form clots. When blood doesn't move, it clots, and you can form a clot in the left atrial appendage, toss it out to the brain. This is where you get big strokes, because this will be a big clot. Usually a little thing breaks off from the carotid. It's a small clot, like a TIA or a small stroke, versus when you toss a big clot from the left atrial appendage, that's a big stroke. Occlusion of the entire middle cerebral artery, MCA, and hemispheric big convexity infarct. That's your classic MCA stroke from AFib. Okay, let's see. Oh, I see lots of brains every month, and I don't see that many big strokes from a left atrial appendage clot. Yes, I do see them, okay, but I see tons and tons of little hypertensive, diabetes-related strokes in the basal ganglia and periventricular flare hyperintensities, okay. Chronic white matter changes, we'll call them. And I see atrophic brains all the time. That's the most common thing I see with dementia. So what I'm basically saying there is the chronic cerebral hypoperfusion from AFib is a more common cause of dementia than the big stroke from AFib. Okay, there's some papers about it. Okay, let's see. Yeah, you get lots of little micro-infarctions. Your periventricular white matter hyperintensities on flare sequence. It's just like a T2 sequence with CSF suppression. Okay, so let's get going to this. Don't ever say good fats. Good fats is stupid. I made plenty of videos about that. There are no good fats. Dietary fiber gets partially converted into fat. That's good. The proper amount of oil is 0, not 1 drop. I agree with Caldwell Esselstyn. I made videos called No Good Fats. And I did a recent video over at VegSource on why there really is no such thing as good fats. And Nathan Pritikin had shown you can eat less than 1% of your calories from fats. There was a couple papers showing that. And the patients did just fine. They needed some omega-6 fats. They didn't even give them supplemental omega-3 fats, and these patients did really well. Okay. The lower the percentage of calories from fat, the skinnier the population. 2 biggest risk factors for AFib are obesity and hypertension. It's good to eat a low-protein diet, too. That doesn't get widely publicized enough, but I've gone over that in a bunch of other lectures and in my kidney book. Let's see. This is a lot of this introductory stuff. It's kind of boring. I want to get to the pictures here. And so the other thing, too, is a lot of people complain, oh, do I have to eat this low-fat vegan diet? And I'm like, are you stupid? You don't understand. Most people are screwed. The average American, by the time they're 60, they're fat, sick, and stupid. And stupidity usually doesn't reverse, so you want to prevent it. Do everything you can to prevent it. And you can reverse cognitive decline in some cases. You can stop eating fish, stop exposing yourself to mercury. You can get your AFib to stop in a lot of cases. Okay, you can stop abusing yourself with all the things that cause diabetes, hypertension, and atherosclerosis. But what I'm trying to say is the proper attitude isn't to whine and bitch and say, oh, do I have to give up ice cream? Do I have to give up alcohol? Do I have to give up coffee? You can do whatever you want. Like I said, if you want to be in the big popular club, join the Fat, Sick, and Stupid Club. That's what most people are like after 60. But if you want to be in that smaller club, like the health aristocrats, that are still thin and smart and energetic and mentally active, okay, then do all this stuff, okay? I would much rather be in the smart, skinny, energetic, and healthy club than in the Fat, Sick, and Stupid Club, okay? And that's what most people do. So, and how do you get into the what's your best chance to get in the the skinny, healthy club? It's eat the low-fat, low-sodium vegan diet, 100% vegan, 100% whole food, single ingredient only, no oil, organic only, no oils, no caffeine, no alcohol, no flour, no artificial sweeteners, nothing with MSG, MFG, okay? And the proper attitude say, that's all I got to do. I'll do it. I'll do it like Flounder in Animal House when he joined the fraternity, okay? Delta Tau Delta, all right? I'm 62. I don't have any medical problems, okay? The guys who eat the meat and the oils, they're going for open heart surgery. They're all sick and pathetic, okay? I'm healthy. My girlfriend's gorgeous, turbocharger Fox. I love being with her, and she's really nice and good and smart. I'm happy, okay? I work a lot. I'm a workaholic, but I do have a good, happy life, okay? And I'm telling you, I don't want to be fat and sick. You don't want to end up like that. Okay, let's see what else here. McDougall recommended to eat a diet of 90% of your calories from starch, 5% from fruits, 5% from veggies. And I think that's a good way when you're just starting out. Try to get yourself up to that much starch. But, if you exercise a lot and you're healthy, you can be a lot more fruit than that. I'm probably 35 to 45% of my calories from fruit. The rest from, about 5% from veggies, the rest from starch. That's working well for me. I know my body weight stays the same. I'm physically strong, got good endurance when I exercise, when I lift weights, and my blood labs are good, so I'm happy with that. So people who exercise more can eat more fruit. Okay, let's see, what else? I recommend no sugar just because you mess up your teeth. Okay, let's see, and stay away from caffeine. Caffeine is bad for health. I've gone over that before. It raises the same hormones as stress and sleep deprivation. Okay. All right, I go through all these other things here. I'm going to get to the pictures. Okay, here's a good quote from Dr. Esselstyn. He says, atherosclerosis is a paper tiger. It need never exist. It's a dietary disease. Stop putting gas on the fire, which means don't eat any animal foods or oil. Okay. Mitochondrial inhibitors actually look like they play a significant role in this. And the goal of the book is to help you to cure yourself so you don't need to get an ablation. Don't get me wrong, an ablation can work very well. I've heard of some good things coming from ablations, but why not just cure it with diet if you can? Okay, what are the different categories of atrial fibrillation? Asymptomatic, subclinical AFib, new onset or first detected AFib, idiopathic AFib of unknown cause. Idiopathic, doctors and idiot patients, pathetic. Postoperative AFib. Paroxysmal AFib comes and goes within 7 days. Persistent AFib lasts more than 7 days. Long-standing AFib, it's been present over a year. Permanent AFib, they've sort of given up on trying to restore sinus rhythm. And then AFib with other diseases, comorbidities, like it can lead to congestive heart failure. It can lead to dementia and all kinds of problems, okay? I think we'll leave it at that for this is an introduction to AFib. In the subsequent lectures, I'll go through all the causes, which you want to know, because a lot of times causation is multifactorial and you can avoid them. I'll go through all the things that cause that are mitochondrial inhibitors, over 100 of them. I'll go through about 100 drugs that are associated with drug-induced atrial fibrillation and a whole bunch of other stuff. So anyways, I hope you'll find it helpful.